patients to each other since we're living through this unprecedented time during a pandemic and COVID-19 continues to spread across all of our communities. If you were in a crowd with non-household members, especially if people weren't wearing their face coverings and were shouting, chanting, or singing, you may have been exposed to COVID-19 since it's very possible that you could have been near a person who was infected with the virus. And as we have learned, people can pass the virus to others even when they have no symptoms. If you attended one of these gatherings, it's very important that you stay away from other people, especially from those at greater risk of becoming seriously ill from COVID-19, and monitor yourself for symptoms for the full 14 days from your exposure. This is essential to prevent the unintentional transmission of COVID-19 to others, especially those who we know are more vulnerable for serious illness. I also encourage you to get tested if you've been in a crowd or a gathering where people were close together and not wearing face coverings and or not keeping their distance. By finding out if you're positive, even if you have no symptoms yet, you can quickly isolate to protect your family, your friends, and your coworkers from becoming infected by you. You also can get the medical care that you need. But as a reminder, a negative test does not mean that you don't need to exclude yourself from being around others for the full 14 days. This virus takes 14 days to incubate. On Friday, I also want to note that the state updated their guidance to allow for private gatherings of 3 or fewer households. As long as the private gathering is outdoors, everyone wears a cloth face covering, and everyone keeps at least 6 feet of distance from each person. Food, if it's going to be available, needs to be in single-serve disposable containers, and the duration of the gathering needs to be short. Tomorrow, we'll be updating the health officer orders here in LA County to align with this change in the state guidance, noting that all gatherings with people who are not in your household increase your risk for transmitting or becoming infected with COVID-19. It is recommended that if you do gather with 2 other households, you do so with the same households each time, creating a quasi-bubble that can reduce the risk of spreading the virus to others. A single household or a living unit does not include institutional group living situations such as dormitories, fraternities, sororities, or residential care facilities, nor does it include commercial group living arrangements such as boarding homes, hotels, or motels. And please note, it's critically important that you don't attend any private gathering if you're experiencing symptoms of illness, you've tested positive for COVID-19, or if you were exposed or likely to have been exposed to someone who is positive. So for all of you who are participating in celebrations or protests, please don't now go to gatherings until your 14 days is over. Please note that it's also important to remember that while these small private gatherings are allowed, large public events and large gatherings, with the exception of those that are happening with houses of worship or those that are associated with a public protest, those other kinds of gatherings or large public events remain prohibited by the county health officer order, even if they're being held outdoors. And there's nothing in the state's revised guidance that changed this. I want to transition for a moment to just talk about the fact that an important strategy here in LA County for reducing community transmission of COVID relies on individuals and businesses complying with health officer orders. So whether we're talking about individuals needing to keep their distance and wear their face coverings when they're around others, or we're talking about businesses that are reopening now to permit indoor activities with their customers, all of us need to comply with the health officer orders. As we continue the recovery journey and we have additional permitted reopenings and activities, public health does continue to also track outbreaks and we increase our efforts to provide assistance to those sectors that are reopening so that they have an easier time understanding what the requirements are and in fact adhering to the requirements. Will you please pull up the first slide? This slide gives you a picture of outbreaks that we've been managing in non-healthcare and non-residential workplaces from March all the way through the very beginning of October. Outbreaks in workplaces are of special concern to us because they represent a situation where a large number of people can get exposed to COVID-19 in one location, but also those very same people, when they return to their communities and their homes, can in fact infect others. We require all employers to implement the safety protocols for their sector when they're open. We also require that if they experience 3 or more positive cases at the work site, they need to report the cluster of cases to the public health department. And this is so that we can assist them in making sure that their infection control and distancing protocols are appropriate, and we can advise all of the employees about what to do to protect themselves and their family members from infection from the virus. As you can see, this graph breaks down the workplaces in 6 different categories. The 2 categories at the top, the white line and the red line, are the categories I want to focus on for today. The top line, which is in red, represents general work sites, and this includes most work sites, from warehouse facilities to essential office buildings to retailers and manufacturing facilities. And you can see after the July spike that we had in outbreaks at workplaces, similar to the spike we saw in cases, hospitalizations, and deaths, we also, in terms of outbreaks that we were following, saw a decline in outbreaks. This corresponds to some businesses needing to reclose. I want to note that, however, we saw this steep decline. We have had a recent increase in outbreaks that is being investigated at all of these work sites. The 2-week period from September 6th through the 19th saw only 23 outbreaks at these work sites, and this is really the lowest number we've seen since June. But in late September through early October, we saw the number of work sites begin to increase again, and now we had over 39 outbreaks being investigated in just a 2-week period. And for us, this is a cause for concern, and we'll continue to be monitoring what's happening at workplaces. I want to note that the white line, which represents food facilities, had a similar spike in July, but unlike what's happening at the majority of our work sites, represented by the red line, we do not see a peak that's happening in our food facilities, similar to what we're seeing in the general work sites. The food facilities include restaurants, bottling plants, food processing facilities, grocery stores, and other food-related businesses that operate in the county. You know, as more businesses are reopening, we may see more outbreaks. This in part reflects the fact that there's more reporting that's being done at the work sites, but it also reflects the fact that there may be more transmission as there's more interactions among different people. It's our goal, however, and I think it's a shared goal with all of our businesses, to make sure that we're notified as early as possible when there are cases at a work site, because this is a strategy that we can use to successfully make sure that the few cases that they may be seeing at a work site does not quickly translate to dozens and dozens of cases. Most work sites need our team to come in and be helpful, both with the identification and testing of cases, but also with making sure that we're isolating and quarantining employees as appropriate. We'll take the next slide. Inspectors from public health are also out every day visiting businesses to ensure that they're complying with required infection control protocols for their sector. And we can go on to the next slide. As inspectors are out, we're reviewing the protocols with business owners We identify any deficiencies, and when warranted, we issue citations and fines for those sites that are out of compliance. This slide shows violations by sectors for inspections occurring between August 28th and October 7th. And it does provide the details related to business compliance with 4 requirements that are in the health officer order: the availability of a disinfection plan, employees' use of face coverings, patrons' use of face coverings, and adherence to physical distancing requirements. As you can see, we are generally finding very high levels of compliance with most directives, and we thank all of our businesses for, in fact, implementing the safety protocols. There is one area for improvement, and that is compliance with physical distancing requirements. But even here, on our inspections, adherence was fairly high at about 85%. Many thanks, deep appreciation to everyone for adhering to the required protocols. The actions people are taking protect employees, customers, and families. And this is the most essential work we have to do now
Katie, can you open this for me?
the continued transmission of COVID-19 in our communities. Next slide.